Hello, my name is Joanna Lipner and I am Managing Director of Pikralida. Pikralida means common dandelion in Greek, so this is the link to a logo, but the name of the company also links to the to the surnames of co-founders. Pikul, Krause, Lipner, so we are still have a place for da, and we are waiting for the person. So we are neurology-focused biotech startup. I would like to briefly tell you about unmet medical needs that we would like to address with our solutions and our projects. So first, unmet medical need is the lack of cure to protect patients that are having stroke or traumatic brain injury, because after this kind of events, the epilepsy can develop. And probably most of you think that epilepsy is something that you are born with, but no. You can, after incidents, accident, stroke, develop this kind of disease. Each year there are 4 million cases of traumatic brain injury and stroke in both US and EU. And depending on the severity of this injury, 3 up to 15% of this patient can develop epilepsy, and they were required pharmacotherapy to the end of the life. And we would like to develop a drug that would help them and protect against this kind of disease. The second unmet medical need that we are working on is a new drug, a drug for amyotrophic lateral sclerosis. This is a very severe disease. After the diagnosis, usually patients die within 5 years because their neuron system start to degrade. At the beginning, they have problems with movement, then the full paralysis occurs, and they die because of respiratory muscles arrest, and they just cannot breathe. And another unmet medical need, and that this is very often, especially in the elderly population, people are taking a lot of drugs because they are suffering from diabetes, hypertension, very different diseases, and they need to take a lot of drugs. And we would like to simplify their life so they could take less drugs and less frequently. And our company is drug development company. We are working on innovative drugs, innovative formulations. We set up our company in 2019. We are now a team of 21, and the 22nd person is joining us in October. We are operating in 2 cities, in Warsaw and in Poznaj, and we have 200 meters space lab. And we also raised public funds to run our R&D projects. We raised over 20 million of Polish zlotys. Here are our labs, laboratory in Poznaj, where we work on innovative formulations. We have analytical and technology lab. In Warsaw, we have synthetic lab. And I would like to briefly present you our pipeline. We have 2 projects in our innovative portfolio. We have a project where we look for a drug preventing development of epilepsy, and we are now on the preclinical stage. We are preparing ourselves to run phase 1 study in healthy volunteers next year, to start phase 2 study in patients in 2024. We have grant funding for this project. And we also have a project when we look for new innovative therapy for orphan drug, amyotrophic lateral sclerosis. We are now at the discovery phase, and we would like to run phase 1 study in 2026. We also have several drugs in our generic plus portfolio, so we are working on fixed drugs combinations to help people to take less drugs and less frequently. And to summarize our business model, so we are working in a hybrid business model. We are working on our own R&D projects, innovative drugs and generic plus, but we also care about our cash flow, and we are doing R&D service for pharmaceutical companies. And it enables us to run the company. Up to date, we are self-funded. We invested, co-founders invested in the company. We also raise grants, and we also have some cash flow from CRO service. We have very experienced team of scientists having experience in both drug discovery and development. We are aiming at unmet medical needs. We work in hybrid business model. We gained 20 million zlotys of public funds, and we expect to go for IPO within 2 years. We are now looking for investors, would like to collect 1 up to 2 million euros to continue our R&D projects and also to invest in R&D infrastructure. I'm happy to answer to your questions.